A physiatrist is interested in whole person function, in what a person can do, what the barriers to doing that are. And in order to really sort through that skillfully, a physiatrist needs to understand pathology, anatomy, physiology, pharmacology, really to begin to sort through what might be the sources of a person's downstream impairment in functional health. Once you have that equation, you can begin intervening with that, on that, either with the skills that a physiatrist has, bringing in other people, and then engage the rehabilitation team, all the therapists and so on. Then you can move towards a person improving function and quality of life, which is our goal and which we can do.
When a patient comes to us and they've seen these other doctors that either gave them an answer or had no answer for them, but either way they're not fixed, so to speak, they come to us, and what they find is that we put a lot more time towards it, to really getting at the answer. Usually that's literally more time with them, and I think that that's a lot more emphasis on something like an exam, where we're really just starting from scratch with them and going back to the basics, listening to them, examining them, and putting all of that together to come to, if not an answer right away, at least a workable plan for them.
Physiatry is so much. There's so much that we do. It's more than just dealing with patients that have traumatic brain injury or spinal cord injury or chronic pain and musculoskeletal dysfunction. It's really interacting with your patients, optimizing their function so that they can continue to do the things that they enjoy, the things that give them meaning.
When you can support a person in their functional health and quality of life, it supports them it creates a context that makes the likelihood that they're going to find this potential towards the end of their life, or for however long that life is, to find a deeper meaning for their life. And it really underlines and highlights and bolds quality of life in what we do.
A physiatrist is unique in the way we approach certain medical conditions. Maybe not so diagnosis-based, although in some circumstances we are, but more focused on recovery and optimization of not just health, but overall function and return to the activities of life.
Physiatry is more than just prescribing physical therapy. It is a comprehensive way of looking at a patient, at their mind, body, spirit, their independence, their function, and finding a plan with the help of other providers so they can be independent again and they can enjoy life.
There are multiple avenues that we may wish to steer a patient down, but in those corridors, they have choices open to them. So I definitely think it's a partnership with patients, which develops a strong patient-physician relationship.